Today, we will discuss the implication of patient safety in nursing informatics. I am Dr. Edmar Aseberos, and with me are Sir Efren Saldua and Sir Jhune Guirjen. Nursing informatics is crucial to patient safety, leveraging technology to improve care and reduce harm. It is essential to address the significant portion of preventable patient harm, leading to cost savings and minimizing medical errors. However, the role of nursing informatic professionals require constant adaptation and learning to ensure ethical, safe, and effective use of technology in all nursing practice.
First, I would like to show you some important facts and figures. Did you know that 1 in 10 patients in high-income countries is harmed while receiving hospital care, and 50% of these harms are considered preventable according to WHO in 2023? Unsafe medication practices and medication errors are a leading cause of injury and avoidable harm, with global costs estimated at 42 billion US dollars annually. Studies show, according to Joint Commission in 2021, that nurses equipped with informatics training are 3 times more likely to report and mitigate near misses or risky conditions using digital reporting systems. Patients report higher satisfaction and trust in facilities where nurses use digital systems to provide and verify treatments and record vitals in real time, enhancing transparency of care, according to WHO in 2022. So in a global healthcare arena, patient safety is still a pressing issue. The WHO reports millions of preventable injuries and deaths due to unsafe care, but many of which can be avoided through better systems like nursing informatics.
Nursing informatics. Nursing informatics involves the integration of nursing science, computer science, and information science to manage and communicate data, information, and knowledge in nursing practice. It plays a critical role in enhancing patient safety through technology and data-driven care. The core components are nursing science, which involves understanding nursing practices and patients' treatment, computer science, which facilitates healthcare operations through technology, applications, and systems, and information science, which involves organizing, maintaining, and retrieving health-related data. What is patient safety? Patient safety is the absence of preventable harm to a patient during the process of healthcare and reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum, according to World Health Organization in year 2023. Why is patient safety is important? It is very important to prevent avoidable deaths and injuries. Another reason why patient safety is important is to build trust in healthcare systems. As we all know that the patient feels safer when they know the hospital are focused on minimizing harm. The third reason is it reduces healthcare costs. Preventable harm leads to additional treatment, lawsuits, and longer hospital stays. And lastly, patient safety is important to improve quality of care. Safe care is effective, efficient, and patient-centered.
Nursing informatics is a field that integrates nursing science with information science and technology to enhance patient care. It involves the use of electronic health records, clinical decision support system, and other health information technologies to support nursing care practice and improve patient outcomes. It is changing the way hospital operates, allowing more patient efficiency patient care, real-time communication, tracking patient progress, and saving time and money. Nurses can now focus on more important tasks such as providing direct patient care and assessing educational materials and resources. Overall, nursing informatics has the potential to significantly improve patient care by supporting nurses in their work and providing the best possible care. Nursing informatic tools can manage patient information, monitor progress, and support care delivery. It can improve patient communication, manage charts and records, track nurse appointments, and perform critical tasks more effectively. The application of nursing informatic in patient care is diverse and can improve patient outcome in various ways. In our setting, our real life clinical data from thousands of dialysis centers worldwide can support physicians and nurses in developing and enhancing clinical practices aimed at delivering better outcomes for every member of the kidney care community. The Euclid, or European Clinical Database, a clinical management system, is implemented in 14 Fresenius kidney care clinics in the Philippines, providing comprehensive information of each dialysis patient and treatment. Euclid allows the medical staff in Fresenius kidney care centers to take the right decisions to improve treatment for each individual patients. Additionally, it offers a wide array of opportunities from mobile physician and patient apps to the use of the latest technologies such as artificial intelligence.
The next implication of nursing informatics to patient safety is enhanced communication. We all know that communication is vital in the nursing practice. This includes standardized documentation as well as shared digital records to improve coordination and safer delivery of nursing care to the patients. Did you know that standardized electronic documentation improves nursing handoffs and reduces communication errors by up to 70%? Yes, nursing informatics systems provide a structured, legible, as well as shareable records that enhance interdisciplinary communication, especially during handoffs or endorsements, as well as during emergency transfers of patients. I am currently working and living here in Germany. And in this country, all people working and living here have the right to access to healthcare. And all individuals possess a Krankenversicherungskarte or Gesundheitskarte, or in English, it's simply a health card. In this health card, it all contains your basic information, just like your name, your birth date, and your address, and some of your numbers like healthcare number or insurance number. But you can also specify the contents of your card. For example, if you have allergies to medications, if you have medications that you are currently taking or maintaining, and even if you have chronic or acute illnesses that's reportable, just like HIV or AIDS, or do you have history of MRSA, and the likes. So basically, you need to have your health card with you because in case of emergency, the card can be scanned by the healthcare provider and have the access to your basic information as well as the information that you have allowed to be in the card. For example, the list of medications that you take, if you have allergies or if you have some illnesses that you have disclosed. In the healthcare setting here in Germany, it is known that different hospitals or healthcare providers have different softwares or providers of electronic health records. However, these softwares are very secure and very safe, and only pertinent members of the healthcare team or multidisciplinary team have access to pertinent information of the patient. In addition, the Germany healthcare system is also gearing towards paperless technology, as well as the use of artificial intelligence in healthcare system. That means many healthcare facilities have either portable computers at work, or in our case, the use of iPads or mobile devices at work. There are some available iPads or tablets for the nurses in the units or stations, where they can directly use them for access to laboratory records of the patients, images, check doctor's orders, and even upload results of tests like blood sugar as well as ECG results in real time, and that is also known as POCT or point of care technology, as well as access to interdisciplinary treatment like physical therapy, medication or pharmacy, and the likes. The next key factor of nursing informatics to patient safety is evidence-based practice. Nursing informatics empowers evidence-based practice. As mentioned earlier, in our facility, through the use of mobile health technology, paperless technology, as well as artificial intelligence, we nurses have access to latest journals, protocols, as well as standards in the hospital, and it increases both the safety and quality of nursing care to the patients. Informed nurses is equals to informed care decisions, and is equals to safe and quality delivery of patient care.
In addition, two key factors in nursing informatics that enhance patient safety is to improve clinical decision-making with the use of real-time access to patients' data through electronic health records. In the NHS in the UK has implemented the Lorenzo Electronic Health Records systems, which was created by DXC technology. Lorenzo was initially deployed across over 20 NHS trusts in the UK between 2010 and 2015 as part of National Program for IT. The global adoption of electronic health records has transformed healthcare systems around the world, while implementation varies by country and region. Another informatics skills that could help improve clinical decision-making is the use of clinical decision support system, which provide alerts for allergies, drug interactions, and abnormal lab results. It also reduces diagnostics and treatment errors. Clinical decision made by nurses affects 95% of direct patient outcomes. Nurses are central to patient care. They assess, intervene, and evaluate outcomes. Clinical decision support systems in the United Kingdom have significantly influenced the healthcare landscape, especially within the National Health Service, or NHS. Their effects spans clinical care, workflow, efficiency, public health, and policy implementation. Informatics skills will enhance safer and more informed care planning. Another informatics skills which is very important is the reduction of medication errors with the use of barcode medication administration, or BCMA. Nurses using informatic tools can reduce medication errors by over 80%. Tools like barcode medication administration, or BCMA, integrated with the nursing workflows ensure the 5 rights of medication: the right patient, drug, dose, time, and route, and it reduces human error drastically. BCMA has had significant global effects on healthcare by greatly reducing medication errors by up to 80% in some settings, and improving patient safety through verifying the 5 rights of medication administration. It enhances the documentation accuracy and accountability by automatically recording data into electronic system and supports standardized workflow and auditing. In low and middle income countries, BCMA is also used to improve vaccine safely and prevent counterfeit drugs. The future BCMA includes the integration of mobile technologies, RFID systems, and AR-powered safety tools, contributing to broader efforts to enhance global medication safety. And this means that safe technologies is equal to safer medication.
Challenges to consider are privacy and security risk, system errors, and lack of training. Healthcare data breaches can lead to identity theft, fraud, and financial losses, eroding trust and posing compliance risk. To protect patient safety, strong IT protocols, including encryption and access control, and staff training on cybersecurity best practices are crucial. Solutions include encryption, access control, regular security assessments, staff training on cybersecurity awareness, incident response, data privacy, and enhanced communication. Open dialogue and transparency can foster trust and collaboration, while ensuring compliance and regulations like HIPAA or Health Insurance Portability and Accountability Act of 1996. Challenges to consider are privacy and security risk, system errors, and lack of training. Healthcare data breaches can lead to identity theft, fraud, and financial losses. The second one is the system errors from software bugs or hardware issues can cause downtime and data loss, affecting important services and patient care. These failures can result from hardware malfunctions, software problems, power outages, network issues, human errors, or lack of resources. Such failure can lead to downtime, which delays patient care and business operations and data loss, which can lead to breaches and legal issues. In healthcare, downtime can prevent access to patient information and disrupt clinical documentation, risking patient care. To combat these issues, organizations can adapt several strategies. Redundancy ensures that if one system fails, another can take over. Rigorous software testing helps catch bugs before they cause crashes. Fail-safes like automatic backups and recovery system aid to quick recovery from failures. Additionally, organizations should create business continuity plans for disaster situations and conduct regular audits and risk assessments to find vulnerabilities. Monitoring tools can also help catch issue early. By addressing potential failures, organizations can reduce downtime, safeguard data, and maintain essential services like patient care. The second one is the system errors from software bugs or hardware issues can cause downtime and data loss, affecting important services and patient care. These failures can result from hardware malfunctions, software problems, power outages, network issues, human errors. The third one is the lack of training and digital literacy can cause mistake in data entry and poor reactions to alerts. Providing ongoing training and education in digital skills is essential. This training helps people understand proper procedures, data entry methods, and alert system, which can reduce errors and improve efficiency. Errors can lead to serious issues such as inaccurate reports and missed deadlines. Regular training and digital literacy education empower individuals to use technology effectively, leading to a better data accuracy and overall outcomes.
First, develop and implement safe, user-friendly health IT systems. This means that nursing informatics professionals are directly involved in the design, customization, and implementation of health information technologies such as electronic health records, clinical decision support systems, and medication administration tools. Second, train and support clinical staff. Training is essential to ensure the clinical users can safely and effectively use health IT systems. Nursing informatics professionals develop and deliver training programs, manuals, and on-the-job support for healthcare staff. Third, analyze safety-related data to drive quality improvements. Nursing informatics professionals collect and interpret data from various sources: incident reports, AHR audit logs, patient outcomes, and safety dashboards to identify trends and root causes of safety events. And lastly, it ensures compliance with safety standards and data protection regulations. Nursing informatics professionals help healthcare organizations stay compliant with national and international standards related to patient safety and data security, such as those from the Joint Commission, Health Insurance Portability and Accountability, General Data Protecting Regulations, or International Standardization Organization.
We present to you the infographic presenting the interrelationship between the three: nursing, informatics, nursing care, as well as patient safety, which brings better outcomes for the delivery of care for our patients. In behalf of my colleagues, Mr. Efren Saldua Jr. and Dr. Edmar Aseberos, my name is Guirjen, and we would like to leave you some thoughts to ponder on nursing informatics and patient safety. Nursing informatics brings data to light, guiding each nurse to do what is right. With every click, a life we defend, where safer, smarter care is the end. And with that, we would like to thank you for your time and your attention. God bless us all.